door, I would check for any precautions such as fall or isolation. Walking into the room, I would assess for any environmental hazards, any scene safety issues. Walk in, perform hand hygiene. Good morning. My name is Ryan Murphy. I am a student nurse, and I'll be performing a bedside assessment. Can you tell me your full name? Can you tell me your date of birth?
9/1/86.
Okay. Patient's body position is sitting. Facial expression is relaxed. Her hygiene, she looks clean, well groomed. I would go ahead and get a full set of vital signs, which include blood pressure, pulse, temperature, respirations, and pulse ox. And I would assess for any pain. Are you in any pain right now?
No.
So on a scale from 1 to 10, you would be a what?
No.
No pain at all. Okay, great. All right. Could you tell me your full name?
24 Watson.
Okay. Can you tell me where you are right now?
Montana Hospital.
Okay. Can you tell me what day of the week it is?
It is Thursday.
Okay. Patient is alert and oriented times 3. She is making appropriate eye contact with me. Check the pupils. Her pupils are equal, round, reactive to light, and acuity. I would describe them as a 4 millimeter. Can you smile real big for me? Patient has no ptosis or facial droop. Can you feel me touching on your hand?
Yes.
Which hand am I touching on?
Left.
Can you feel me touching on your feet?
Yes.
Which foot am I touching on?
Right.
All right. Patient has good sensation in all of her extremities. Her speech is clear, logical, articulate, and appropriate to her. Are you able to swallow?
Yes.
Okay. Patient can swallow. Her breathing is quiet and effortless at an appropriate rate. Go ahead and listen to lung sounds. This would typically be done skin to skin, but for this assessment, I will be doing it on top of her chair. Take a deep breath. Lung sounds are clear bilaterally. I would assess her fingernails for any clubbing, cyanosis. I could also check GCAP refill, which is less than 2 seconds. All right, are you able to cough? And when you do cough, do you get any mucus? Okay. Next, I would listen to her apical pulse for 1 complete minute. Listening for S1 and S2 sounds. Make sure they are regular, which they are. I would also take her apical pulse and palpate her radial pulse simultaneously to make sure they match, which they do. Now assess all heart sounds: aortic, pulmonic, mitral, and bicuspid. I would repeat that again with the bell of the stethoscope. Palpate her radial pulses bilaterally. They are +2. Palpate. Patient does not have any pretibial edema, left or right. Post-tibial pulses are palpable, +2, left and right. And dorsalis pedis pulses, left and right, are palpable, +2. All of her extremities are warm. Her skin is pink, warm, and dry. Turgor is brisk. Her skin is intact. There is no breakdown or lesion. Patient's head, chest, hips, legs, arms are all symmetrical. I do not note any deformities at this time. Are you able to pull back on my knee? Can you push forward on my knee? Upper extremity strength is equal bilaterally. Can you pull up on my knee? And push down like a gas pedal? Lower extremities are equal bilaterally. Okay. Patient's nutritional status is she looks well nourished. the contour of her abdomen is flat. I would also take bowel sounds in all four quadrants. Bowel sounds are active. Palpate her abdomen in all four quadrants. Is there any pain when I palpate? Okay. No masses noted. When was your last PM?
This morning.
Okay. And was it normal for you?
Yes.
Okay. And what was the last thing you ate?
Dinner. This morning. Chicken last night. For dinner.
Okay. Sounds good. And has your diet changed in any way recently?
No.
So no diet intolerances going on? Okay. Are you avoiding urine?
Yes.
All right. Have you noticed any odd color, clarity, quantity, or odor?
No.
Okay. I would take note to any equipment in the room, starting with oxygen equipment, noting its placement, and settings, anything like that. I would notice IV pumps, noting their rates, where the catheter is, its location, its patency. I would note any dressings that the patient has that need to be changed, any drainage, anything like that. If she were wearing any compression stockings, we would take note of that. If she's on bed rest, I would move her every 2 hours. I'd also assist her with transitioning to a chair if she needed it, noting any activity intolerance, or if she needed any aids with ambulation, such as a walker, a cane, anything like that. In enclosure, make sure the bed is in its lowest position, wheels are locked, side rails are up, bed alarm is in place, call bell is in reach, and I would document everything